My name is Norm Christopher. I'm the chairman of the Department of Pediatrics at Akron Children's Hospital. Very proud to be associated with the Haslinger family program in pediatric palliative medicine. The most important thing I'd like to say about the program is, in addition to all of the really wonderful impact and outcomes it's had for our patients and families, the program has had a remarkable effect on the staff. It has really changed the culture of an institution, and as Dr. Freibert will say, it's done that very subtly and over a long period of time. But I will say the culture of the institution has changed as a result of this program. The program provides a linkage between what we do in the hospital and the services that are really best provided in the home. The traditional healthcare delivery model is focused on hospital-based services, critical care, and procedures. The model that we've adopted as a result of this program really has moved the care continuum out into the community. It provides services for children and families in the home. It focuses on prevention and wellness and really serves to keep children in the environment where they're most comfortable and where their health can be maximized.
I'm Sarah Freibert. I'm the director of the Haslinger Family Pediatric Palliative Care Center at Akron Children's Hospital in Akron, Ohio. Winning this award has been a tremendous honor for us. Pediatric palliative care is a relatively new field. Not much is known about it. A lot is still feared about it. And when we win an award like this, it really puts us on the map in terms of this being something that needs to come out into the light, needs to be funded, needs to be recognized, and it really gives us a way to shout out how proud we are about the work that we do. We have many, many families who are struggling with desperate, serious illnesses when their children are sick. They need these resources, and they need teams like our families receive in Akron, Ohio. And unfortunately, we just don't have access to these kinds of teams and this kind of care throughout the country. So through the Circle of Life Award shining an important light on this kind of care, my hope is that every hospital, every community, every hospice will invest the resources necessary to make this care accessible to every child who needs it.
My name is Lisa Long, and I'm Office Coordinator for the Haslinger Pediatric Palliative Care Center at Akron Children's Hospital. We're very honored to be here and receive the Circle of Life Award, and we will continue doing what we're doing and educating people and hopefully helping a lot more people.
My name is Michael J. Brescher, MD, Executive Medical Director at Calvary Hospital of Bronx, New York. We're very excited about the honor given to us by the American Hospital Association in the area of palliative care, the treatment of end-of-life situations. This is a term that was barely known 10 years ago and now has come into the forefront. And we look forward to talking about the Circle of Life, what the award means to the medical programs at Calvary Hospital, and how we can use this award to expand our own influence, not only with the community, families, patients, but also with the government agencies and with the Congress itself. At the end of the day, when you're holding a baby in your arms or an elderly person and you've treated their symptoms and you dress up, what you have done is you've walked into a patient's room, but before you leave, you've turned it into a sanctuary. And as a sanctuary, even the angels are counting the tears that that patient and family have spread.
I'm Susie Johnson. I'm the Vice President of Sharp Hospice Care, part of Sharp Healthcare in San Diego, California. We were awarded the Circle of Life Award for a very innovative program, bringing community health to our patients residing in their own homes. Specifically, we designed a program for patients with chronic illness, advanced illness, heart failure, COPD, and dementia, really bringing a consultative model so that we could educate patients and their families about the disease, how to manage their disease in their own environment, and really match their lifestyle to their disease. The reason the program is important and so effective is that we have really been able to align patient goals of care along with their value system and bring the care into their own home. We've really found that patients and families use the most reactive method that they know, which is when they get into trouble, go into a hospital. By bringing care into a patient's home and saying, how do you want to be cared for as this disease progresses? It's not a matter of if, it's a matter of when that your disease is going to lead to your end of life. We bring some reality into the patient's life and help them learn how to cope and manage their disease in their own environment.
My name is Terry Eason. I'm the Director of Community Peds Care, the Pediatric Hospice and Palliative Program of Community Hospice of Northeast Florida. It's quite an honor to have won the Circle of Life Citation of Honor Award. This is a demonstration for our program of the great work that we're doing, and so we feel quite proud to have achieved this recognition. Our program is a community-based program. However, we provide services in the hospital, in an outpatient clinic. We have a number of children in our Northeast Florida area with chronic, complex conditions as well as life-threatening conditions who are in their homes, and some of them attend school, some of them are unable to attend school, but they range in age from birth to age 21. And we provide an interdisciplinary model of care to them in the home based on their goals they've identified, as well as their needs, what's important to them at the time, on pain and symptom management and working with their physician in the community, and working with the family members and the siblings. We also follow them to the hospital, providing a seamless continuum of care so that they have a recognizable face when they're at the hospital during difficult times. We also have a pain and palliative clinic that our physicians work with some of the patients in ensuring that their comfort is maintained while they're out in the community.
My name's Melvin Sterling. I'm a palliative care physician. I'm the co-medical director of the palliative care program at St. Joseph Hospital. We've given a lot of thought to the need for a palliative care program and what its goals should be. And our hospital, our board of directors, our medical staff feel very strongly, and this may sound trite, but we really believe in the golden rule. We think people should be treated the way we would like to be treated, and that means that suffering needs to be identified and addressed. And we need to bring to bear all of the resources that are at our command and beyond. We'll go out to seek further resources where what we have at hand is not adequate to minimize suffering and to minimize suffering not only for the patients but for the families.
Rosemary Lay, nurse practitioner of St. Joseph Hospital in Orange, California. We often use a tool in family conferences. We encourage having family meetings with family members, the patients, and all of the physicians and people involved in the patient's care in the hospital. And with that tool, we are able to identify their wishes and goals and answer questions that they have that oftentimes requires answering several times for them to understand, and translating the medical jargon into information that they can understand and use to be able to make their decisions. We are, I think, the best program that we have in our county, in Orange County. There are no other programs within our county that offers our patients and our community what we do. I feel very privileged and very proud to work at St. Joseph Hospital.
My name is Amanda Sommerfeld. I'm the Assistant Medical Director of Unity Hospice in De Pere, Wisconsin. Unity's palliative program in particular is very unique because it provides the same types of services and the same interdisciplinary team as the hospice patients receive. So this means that our patients have access to the skilled nurse who helps with medication and symptom management. They have access to social workers and chaplains to help with psychosocial and spiritual suffering, and also to our bereavement counselors and volunteers and skilled nursing assistants. So it's really a very unique program for our patients in Northeast Wisconsin, and the idea is that patients can receive care where they want to be, which is in their homes and in their communities. I think what this award means to us is it's a validation of the work that we've been able to do in Northeast Wisconsin, and a validation to all the Unity team members in recognition of the hard work that they provide every day to our patients and families. But I think it's also an important point to note that it means we have a lot of work left to do. And so it's an honor, but it's also a challenge to us to do better for our patients every day.